Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I'd like to welcome everyone here today at 7th Street Plaza and welcome everyone tuning in on Facebook Live. I'd like to acknowledge that we are gathered today on Treaty 6 and Métis Region 4 territory, a traditional meeting place and home for many Indigenous peoples. This has been a consequential month here at Alberta Health Services. Well, they all are. November 3rd, the first wave of Connect Care launched at several sites across the Edmonton zone. For those unfamiliar with Connect Care, it's a new way of using and sharing health information. Connect Care gives healthcare providers at AHS and its partners a central access point for more complete, up-to-date patient information and for best practices. It also provides patients with better access to their own information. And it will be easier for healthcare providers to communicate with patients and with each other. When Connect Care is fully rolled out by 2022, it will improve healthcare in the province by ensuring the whole healthcare team, including patients, has the most comprehensive information possible through their care journey. AHS President and CEO Dr. Verna Yu has more information about Connect Care's launch and future rollouts, and she'll share that with us shortly. The next consequential event this month, last week I had the great pleasure of attending at a groundbreaking of Alberta's new Centre for Child and Adolescent Mental Health. When it opens in 2 years, it will provide a variety of addiction and mental health services for young Albertans in a purpose-built facility. Bringing this vision to reality was a great team effort that included Alberta Health Services, Alberta Government, including Alberta Health, the Alberta Children's Hospital Foundation, the Calgary Foundation, the University of Calgary, and many very generous donors. The final important November news I'd like to share is to let you know that earlier this month, Alberta Health Services was named one of Canada's top 100 employers for the third year in a row. Why is that important? Because we know that excellent patient and family-centered care is only attainable when our people feel safe, healthy, valued, and included in their work environment. This designation also allows AHS to access national and international job seekers through a variety of high-profile recruitment tools used by more than 15 million people. We want to continue to attract the best people to AHS, and we want to keep the best people here. What's good for AHS, and that's good for Albertans as well. So I'd like to congratulate everyone involved in helping AHS build a positive culture that supports teamwork, encourages collaboration, and empowers our people to do their very best every day for patients and their families. Now, before I hand the mic over to Verna, do all the board members have the agenda? May I ask for someone to approve the agenda? Hugh, thank you. Seconder? Thank you, Glenda. All in favor? Thank you. Having approved the agenda, are there any declarations of conflict of interest based on the agenda items today? Seeing none, we'll continue. You've all seen the minutes from our last two meetings, dated October 9th and October 29th. Are there any concerns, questions, issues, comments? All right. Then may I have someone move approval of both? Thank you, Heidi. Second? Great. Thank you, Brian. All in favor? Approved. Thank you very much. Verna.
Great. Thanks very much, David, and good afternoon to everybody. As David mentioned, a little over 3 weeks ago have passed since we launched Wave 1 of Connect Care. And over that time, our teams at the Wave 1 sites in Edmonton and across the province have really come together to support one another as we enter into a new phase for AHS. There's been teamwork, there's been success, And of course, there have been challenges in working with new technology and adjusting to new workflows. None of this comes as a surprise, and we anticipated that there would be issues during this transition. As issues arose, our 24/7 command structure, supported by teams of well-trained super users and technical experts, addressed them and worked to quickly resolve them. And through it all, patient care continued. In fact, during the first 5 days of the launch, transplant teams at the University of Alberta Hospital performed 4 lung transplants, 3 liver transplants, and 2 heart transplants, and responded to a major trauma incident during the same time period. So we launched Connect Care, and healthcare carried on. And I recently went to visit the site at the University Hospital, the Stollery Children's Hospital, and the Mazankowski Alberta Heart Institute to meet with people on our front lines to get a sense of how Connect Care has been affecting their work. So rather than me telling you about it, I'd like you to see this following video.
Patient safety was never compromised, which was really good because some of the nurses that were on that night, they knew the patients from days before.
Right.
So if there's anything that was not matching, they will know the patient.
Right.
And they say, okay, this needs to happen now. Let's make it happen. And they made it happen. So,
And I think all the doctors are stepping up and helping each other. So all the super users are ready and willing. So I feel like in some ways it's kind of brought the community together.
I know.
I'm a child life specialist down here in Emerge, and I don't have access to the patient lists yet, which is just only a small barrier, but we're just trying to make it work a little bit better.
Good. So that must be the best job ever, to be a child life specialist. Like, I've always wanted to just play with children. How are you doing? How's the phases of care going? I hear that's been a challenge. Or...
Yeah, I think from the Emerge side of things, that's been a bit more of a challenge. But from up here, it's been good.
Yeah, wonderful. All right, well, thank you for,
Thanks for coming by.
being the commander here.
There's some frustrations with exactly how the platform is working, but again, I think it's just because we're on a brand new system and haven't had the chance to really get used to it yet.
Yeah. Hey, Lawrence, how you doing? Good to see you. Hey, how goes Connect Caring?
You know what? There's less issues every day. People are happier every day. Less stress.
We're only on day 3.
I know we're only on day 3.
Wow. Okay, we've got this on tape.
These are
What are these?
wheels.
Really? So I can log in?
You should be able to. I don't know if
try.
they're locked to the nurses, but they should be able to.
Oops. Well, it would help if I could spell.
There you go. It's nephrology.
Cool.
So whenever you come into the rounds, you just go to your patients. It's
And it's saved now?
They'll all be. They will add onto the patient list and take them off as you go along.
Now, have you used eClinician before, or you know?
I came in a few days before.
Oh, okay, all right, okay. Oh, you'll be a breeze. You're young.
I thought so.
Yeah. Like, you know, for someone like me, it'd take me forever to do this. But.
Rovers are those handheld devices that
right.
just started using more today because of the scanning functionality, but it's handy. Our healthcare aide has been using it for when she's going to collect at lab.
Yeah.
She got that today. It was awesome.
Okay, really?
She's so excited about it.
Really?
Yeah, because they can also do vital signs on it.
Right.
But the support that we have is awesome.
Oh, good.
We've had Epic here consistently.
Yeah, a long time no see. How you doing?
Yeah, I didn't know I was walking into a photo op.
Take a picture, smile. I don't think I've tried the billing for inpatients yet, but
it's pretty nice because as soon as you can add favorites or things in,
Right.
I just have my radio buttons that these are the codes that I use.
Oh, yeah.
And on the list, it just tells me exactly what is outstanding. You have these really nice check marks so that you know you're doing
that you've done it. You've done it. Yeah. My favorite part is the percentage. They tell you what percentage you are achieving it. Like we're all such type A's.
I know, the metrics are like, how close can you get to 100%?
That's right. It's like, I want to be above average. Anyway, good to see you, Dennis. So how are the devices going?
Lots of challenges, but they're going good.
Yeah.
You just keep knocking them off.
I bet, eh?
That's good.
How many thousands of devices do we have?
We deployed over 12,000 net new devices to support ConnectCare.
Wow. 12,000, knocking one off at a time. Only got 11,999.
In big batches. In big batches.
All right, well, good job, Brent.
Thanks.
All right, you need to clone you, though, I think.
The voice recognition is phenomenal.
Really? You like the voice recognition?
I'm not a typist.
Yeah.
It's very accurate and really good. I think some of the challenges with the training here has been, it's kind of been, you're flying the airplane when you're building it.
Yeah, right, sure, of course, yeah.
Some of the things are being developed just right at the last minute, and I think once some of these bugs are worked out, I think it'll be a little bit more straightforward because their training will be actually on what's being implemented. Right. I think it's going to be a huge step in the right direction.
Right.
Together, we do amazing things every day.
So I didn't know what to expect when I visited the sites, but I was pleasantly surprised to see the positivity. And even with a steep learning curve, it was really gratifying to see how everybody was working together as a team. And as you can see, we heard about frustrations. It didn't always go as well as expected, but overall, people told us that they could see how ConnectCare will ultimately not only improve the way that we work together, but it would actually improve patient experiences and patient outcomes. They also saw how ConnectCare gives them and their colleagues and their patients the best information and resources they need to provide the best care. So I really want to thank all the staff, physicians, the volunteers, our partners directly that have been involved in helping us roll out Wave 1 launch, as well as all the people across the province who really helped us ease the demand pressures across these Wave 1 sites. Wave 2 is scheduled to launch in spring of next year, and we expect that ConnectCare will be fully rolled out across the province by 2022. And before I turn the mic back to Dave, I just want to remind everyone that we're a little bit over a month now into our annual influenza immunization campaign. Getting your flu shot is the best way to protect yourself and your loved ones from influenza, and so far we've had more than 65 Albertans hospitalized with lab-confirmed influenza. So you don't want to take the risk of getting sick. So if you haven't received your flu shot this year, please, I would encourage you all to do so. It is available free of charge to all Albertans aged 6 months of age and older. You'll find dates and times and locations of the AHS influenza immunization clinics near you on our website at ahs.ca/influenza. So protect yourself, protect others, get immunized, and thank you for your time today.
Thank you, Verna. I would now like to invite Glenda Yates, who is the chair of our Quality and Safety Committee, to give her report.
Thank you very much, David. The Quality and Safety Committee met on November 3rd, 2019. In our meetings, as always, we organized them to focus on the issues of access, quality, and safety. And at the November meeting, we received a report on the Calgary Zone Emergency Department wait times and the success of a number of initiatives that they've put in place there to try to deal with wait times in ERs there. An update on the work of Alberta Health Services Lab Formulary Committee, and a report on the strategic clinical networks and their return on investments. The committee also received a semi-annual update on strategic initiatives of the organization that are aimed at health outcomes and improving those health outcomes. We also received, we regulatory monitor the quality and safety and access dashboard, so we received that dashboard, and we received the quarterly patient safety report. And there were no items that we are recommending for board approval. Thank you.
Thank you, Glenda. Our next report is from Hugh Somerville, Chair of the Governance Committee.
Thank you, Mr. Chair. The Governance Committee met on October 10th of 2019 and again on November 14th of 2019. At the October 10th meeting, in addition to receiving the quarterly update from the Chief Ethics and Compliance Officer, the committee considered 3 items for recommendation for approval of the board. First, the Alberta Health Services Ethics Framework. The ethics framework was recently updated to reflect current organizational information and to align with the AHS communication standards. The committee was presented with these updates and recommended that the board approve the same. Accordingly, I move that the Alberta Health Services Board, A, approve the revised AHS ethics framework as reviewed by the Governance Committee and the Alberta Health Services Board, and B, direct that the revised ethics framework be posted on the AHS public website. I so move.
Thank you, Hugh. Do we have a seconder? Thank you, Stephen. All in favor? Carried.
Second, the terms of reference for the Human Resources Committee. The terms of reference for all board committees are reviewed annually. The Human Resources Committee proposed amendments to their terms of reference. The committee was presented with these amendments and recommended that the board approve the same. Accordingly, I move that the Alberta Health Services Board, A, approve the amended terms of reference for the Human Resources Committee as reviewed by the Governance Committee and the Alberta Health Services Board, and B, direct that the revised terms of reference be posted on the AHS public website. I so move.
Thank you, Hugh. And may I have a seconder? Thank you, Brian. All in favor? Any opposed?
Third were proposed amendments to the AHS medical staff bylaws. The Medical Staff Bylaws and Rules Review Committee has completed a review of the medical staff bylaws and presented proposed amendments to the medical staff for a vote. A majority of voting members approved the motion to recommend approval of the proposed amendments. The committee reviewed the proposed amendments to the bylaws and recommended that the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the proposed amendments to the medical staff bylaws as reviewed by the Governance Committee and the board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and direct management to submit the amended medical staff bylaws to the Minister of Health for approval. I so move.
Thank you, Hugh. Seconder? Thank you, Heidi. All in favor? Carried.
At the November 14th committee meeting, in addition to receiving the quarterly update from the Chief Ethics and Compliance Officer, the committee considered two items for recommendation for approval of the board. First, the committee reviewed proposed amendments to the board member remuneration expense reimbursement and ongoing education procedure and recommended the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the amendments to the board member remuneration, expense reimbursement, and ongoing education procedure with such non-substantive changes that may be considered necessary or advisable, and direct the corporate secretary to post the amended procedure on the AHS public website. I so move.
Thank you, Hugh. May I have a seconder? I'll take Glenda there. Thank you for everyone jumping in. All in favor? Carried. Thank you. Hugh?
And second and finally, the reappointment of an external member to the Quality and Safety Committee. The committee was asked to consider and recommend to the board for approval Gord Winkle's reappointment as an external member of the Quality and Safety Committee for a term of 3 years commencing January 1st of 2020. The committee and the board support the reappointment. Accordingly, I move that the Alberta Health Services Board approve the reappointment of Gord Winkle as an external member of the Quality and Safety Committee for a 3-year term commencing January 1st, 2020. I so move.
Thank you. May I have a seconder? Glenda, I'm sure you'd want to. Thank you. Appreciate that. All in favor? Carried. Thank you.
Those are the matters from governance, Mr. Chair.
Appreciate that. Thank you, Hugh. Our next committee report is going to be from Dr. Brenda Hemmelgarn, and this will also include some matters for approval. Brenda?
Thank you, Mr. Chair. The Community Engagement Committee met on November 15th, 2019. The President and CEO and a board member of the Royal Alexandra Hospital Foundation attended the meeting. A member of the Wood Buffalo Health Advisory Council also attended the meeting. The committee considered 3 items for recommendation for approval of the board: appointments and renewals of members to advisory councils, and the appointment of the chair of the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council, appointments of trustees to foundations, and amended bylaws of the Biche Regional Health Foundation. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare. Given the number of appointments and renewals, the names will not be read in this meeting, but they will be incorporated into the minutes of the meeting and posted publicly. First are the appointments and renewals of members to the advisory councils. The committee considered appointments and renewals to advisory councils and the appointment of the chair of the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council. The responsibility again to appoint or renew these council members lies with the AHS board. The committee recommended the board approve the member appointments and renewals as reviewed by the committee. The board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointment and renewals of members of the advisory councils and appointment of the chair for the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Do we have a seconder? Thank you, Stephen. All in favor? Carried.
Second, with respect to the appointment of trustees to foundations, the responsibility to appoint trustees to established foundations lies with the Alberta Health Services Board. The committee recommended the board approve trustee appointments as reviewed by the committee, and the board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. A seconder? Thank you, Brian. All in favor? Carried.
And finally, with respect to an amendment to the bylaws of the Biche Regional Health Foundation, the committee was presented with a request to amend the bylaws of the Biche Regional Health Foundation to increase the maximum number of board members and to update the bylaws to the current template for foundations that is supported by Alberta Health. The committee recommended the board approve the amended bylaws of the Biche Regional Health Foundation, and the board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the amended bylaws of the Biche Regional Health Foundation in the form reviewed by the Alberta Health Services Board with such non-substantive changes that management of AHS considers necessary or advisable, and direct the same be forwarded to the Minister of Health for approval. I so move.
Thank you. Seconder? Thank you, Hugh. All in favor? Carried. Thank you, Brenda. Our next report will be from the Finance Committee, and the chair of that committee, David Carpenter, will have the report.
Thank you, Mr. Chair. The Finance Committee met on November 21st, 2019, and considered 5 items for recommendation for approval of the board. First, the second quarter 2019-20 investment report as mandated by AHS investment bylaw. The committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. Regional Health Authorities regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented the second quarter 2019-20 investment report and recommended that the board ratify the transaction. The board reviewed the recommendation. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio transactions as described below and as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager North Investment Management. A, as at September 30th, Alberta Health Services held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial totaling $1.065 billion. B, funds were invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended September 30th, 2019 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager North Investment Management. I so move.
Thank you. May I have a seconder? Thank you, Brian. All in favor? Carried.
Second, the committee reviewed proposed amendments to the Alberta Health Services investment bylaw. Alberta Health Services Management reviews the investment bylaw on an annual basis and determines if any amendments are required. The committee was presented with amendments to the investment bylaw and recommended the board approve same. Accordingly, I move the Alberta Health Services Board approve the amendments to the Alberta Health Services investment bylaw as reviewed by the Finance Committee and the board and submit the amended bylaw to the Minister of Health for approval. The amended investment bylaw will be posted publicly once approved by the Minister. I so move.
Thank you. And a seconder? Thank you, Hugh. All in favor? Carried.
Third, the committee reviewed the 2019-20 authorization to spend. In June 19, the Alberta Health Services Board approved an interim spending authorization of $10.191 billion for the period April 1, 2019 to November 30th, 2019. The committee was asked to consider and recommend board approval for an authorization to spend to January 31, 2020. The committee made such recommendation and the board supports the approval. Accordingly, I move that the Alberta Health Services Board authorize Alberta Health Services to incur A, maximum expenses of $13.040 billion for the period April 1, 2019 to January 31, 2020, and B, maximum capital expenditures of $405 million for the period April 1, 2019 to January 31, 2020. So moved.
Thank you. Seconder? Steve, thank you. All in favor? Carried.
Fourth, the committee was asked to consider and recommend approval for restricted grant agreements over $90 million relating to outpatient cancer drugs, specialized high-cost drugs, short-term exceptional drug therapy, rare disease drug, and hepatitis C pathway program. Accordingly, I move that the Alberta Health Services Board A approve the following Alberta Health grant agreements with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 1, a new agreement for the provision of cancer pharmaceuticals to outpatient cancer patients for the period April 1, 2019 to March 31, 2020. And 2, a new agreement for the provision of specialized high-cost drugs to eligible Albertans, which includes short-term exceptional drug therapy, rare disease drugs, and the hepatitis C pathway program in provincial correctional facilities for the period April 1, 2019 to March 31, 2020. And B, delegate authority to the President and CEO to sign these agreements on behalf of AHS in accordance with AHS policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you. Second? All in favor? Carried.
And fifthly, the fifth item is an extension of the continuing care services in Edmonton, Central, Calgary, and South zones for an additional 12 months. Board reviewed the terms and conditions of the extension and supports the approval of the same. Accordingly, I move if the Alberta Health Services Board A approve the proposed amendments to the current agreements with both CBI, Home Health, Alberta Limited Partnership, and CBI Limited with respect to the provision of community home care services effective April 1, 2020, with such non-substantive changes that management of AHS considers necessary or advisable, and B, delegate authority to the President and Chief Executive Officer to sign the amendments on behalf of AHS in accordance with AHS Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you. Second, Hugh. All in favor? Carried. Thank you. David, thank you for that report. I would ask that you continue now as Chair of Audit and Risk Committee and provide that report as well.
Thank you, Mr. Chair. Audit and Risk Committee met on November 21st, 2019. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting and in their role as external auditors of AHS. Committee received a report from the Office of the Auditor General on the Connect Care Wave 1 implementation readiness. Committee also received a quarterly enterprise risk management report, an interim report on internal controls over financial reporting, and the internal audit and risk enterprise management quarterly performance report, which provides an outline of the portfolio's progress. Committee also received legal and privacy update, as well as an insurance update. There was one item presented to the committee to be considered for board approval. Committee received an amended internal audit charter for review and recommendation for board approval. The board has reviewed the amendments and supports approval of same. Accordingly, I move that the Alberta Health Services Board approve the amended internal audit charter in the form reviewed by the Alberta Health Services Board with such non-substantive changes that management that Alberta Health Services considers necessary or advisable. I so move.
Thank you, David. Second? Glenda, thank you. All in favor? Carried. Now, David, may I ask you to put your third hat on and give us a report from the Human Resources Committee?
And I'm acting chair.
Yes, as acting chair.
We have the real chair over there. The Human Resources Committee met on November 27th, 2019. Committee received a standing quarterly report on our people results, a labor relations update, as well as an update on the scheduled upcoming review of our people strategy. Committee also discussed the recent recognition of AHS as one of Canada's top 100 employers for 2020. In addition, the committee received an informative presentation on AHS protective services. There were no new items that came through the committee for board approval.
Thank you, David, and thank you everyone for those helpful reports. We are adjourned. Take care.
Together, we do amazing things every day.